Good evening, everyone. On behalf of Just Being Center for Mindfulness and Presence, I welcome you all for this insightful webinar today. We are thrilled to have all of you with us for this wonderful, wonderful conversation between the experts in their respective fields and who have generously agreed to share their insights with us. So my name is Gayatri, and I would be your host for this particular webinar. Before we dive into the session, I would like to take a moment and introduce our speakers for this evening. I would introduce Sandy first. Welcome, Sandy. She is, all of us probably know her. Sandy is a mindfulness and presence-oriented psychotherapist specializing in trauma and attachment resolution. She is also an internationally accredited MBCT teacher and also developer of presence-oriented psychotherapy program. She's also the founder director of Just Being Center for Mindfulness and Presence. She has literally made mindfulness really simple for all of us. She's certified in MBCT from the University of California. And with several feathers in her cap, today she is with us to give us more insights on presence-oriented psychotherapy in clinical practices. So welcome, Sandy. Looking forward for this conversation. I would now welcome Rucha, Dr. Rucha Sarwate. She is a clinical psychologist registered with RCI, Rehabilitation Council of India. And she comes with a huge experience, about 12 years in the arena of mental health. She currently serves as an assistant professor of practice at Ahmedabad University, and she's also an alumna of the POP program, Presence-Oriented Psychotherapy at Just Being. Rucha holds a PhD from Savitribai Phule University and an MPhil in medical and social psychology from the Central Institute of Psychiatry. Rucha's work is very, very grounded in deep listening. It's also in mindful presence and gentle attunement to inner experiences. Welcome, Rucha. We would love to hear from you now. We can begin with this conversation.
Thank you, Gayatri. Thank you, Rucha, for joining us and for all of you who've joined in. And it's going to be an interactive kind of like session and just a conversation that between Rucha and me. So feel free to kind of join in, and there'll be time for questions. Maybe we can, Gayatri, maybe we can spotlight both. Yeah. All right. So, so I just like to maybe, Rucha, just begin with, and for people who have joined, just in terms of, just going through what is presence-oriented psychotherapy, what we mean by that, and talk a little bit about that. So essentially, presence-oriented psychotherapy is more of a holistic, integrative kind of like approach. But the whole orientation, so it's like orienting ourselves to presence, and all the therapeutic work is done from the sense of presence. And a lot of this is kind of like based on mindfulness and from the Buddhist philosophy that really informs the work. As well as we are also taking, important aspects of psychotherapy as we know it, in terms of like really working with our patterns that we hold, so part of the presence-oriented work is also looking at attachment patterns, looking at how we hold things in our body. So really including the somatic, the energetic frameworks, and also being And also looking at trauma, because those are the trauma imprints that we carry. So, what is it that we get in touch with when we come in touch with ourselves, with our experiences, and really meeting it in a moment to moment way, and whether they are thoughts or feelings or sensations in the body. So, in that's just a gist of the approach. We really look at three aspects, which is looking at the therapist's presence, which is vital. So, a lot of, like, even in the 2 year program that we run, a lot of focus is on the practitioner, and the practitioner really coming into a sense of presence. The second aspect that the approach really focuses on is the relational aspect. So, presence in the relational field. And the third aspect is in terms of supporting the client in presence. So, where we can really look at what we encounter from the sense of presence and being present to our experiences. Of course, we'll unpack this a bit more as we kind of speak, I hope. And any questions that, people listening in, if they have, you can just note it down and then we can kind of take up the questions. I'd also like to say that this is, the 2 year program, which we usually begin in August, is really this kind of step-by-step kind of process of really coming into and learning all these facets that we can then apply in therapeutic work. So, presence-oriented therapy can be used as an approach by itself, but it can also be blended and used with other approaches. Yeah, and so the framing of it is that such that we can accommodate. It's like a transdiagnostic approach, so it moves across diagnosis, and so we can really work with whatever kind of shows up and whatever the client is being faced with. And maybe, Rucha, maybe if you can share some perspective on maybe clinical psychology and how we really look at what's the view that we take and what's the orientation usually from that framework. And then we can see how these two can come together in places that maybe it doesn't come together. Yeah.
Sure. Thank you, Gayatri. Thank you, Sandy. It's an honor to be here because for my own understanding also, I can see shift being trained in clinical psychology, where in fact the name also says medical and social psychology, and then really getting disenchanted by the diagnostic framework. And then after joining in the presence work, how, I can see the balance now that I feel within myself when I look at these categories of psychopathology. So maybe just to begin with the clinical understanding, I would like to share that it's an evolving field that still in the developing condition, especially in India as well. But apart from that, we can see how it has shifted its focus primarily on locating psychopathology in human being at the level of, something is tremendously wrong with the mind. And that's why even if we look at the terminology that has been present as we offer support, it came more from managing the symptoms. But however, as the, from we can see the shift happening even from the space of psychoanalysis, behaviorism, cognitive therapy, now the third wave of behaviorism. And currently when we have more approaches based on mindfulness, IFS, internal family systems, trauma work that is getting integrated, and now how it has been shifting more towards really looking at the whole of a person. At the same time, for clinical psychology, it's very important to really locate the symptoms. So we still follow the diagnostic criteria as given by DSM or ICD, currently 11 and DSM-5. But the whole intention now, again in the training also, is ability to identify a diagnosis for a person based on the conditions or the presenting complaints that are there. And then the whole approach that we take for the diagnosis is also after the assessment. How can we use that information in order to come up with a treatment plan? So again, as I said, the words still revolve around the treatment plan, but the intention definitely has shifted from looking at as a patient to a client, and after the also taking into account the humanistic existential forces, shifting more to the person of behind those symptoms. But for the clinical psychology, we primarily look at in the practice also when we get a diagnosis. Now there is an emphasis on looking at the background information. Every school of psychotherapy, for example, cognitive behavior therapy, will have their own case formulation. And I think this is where it brings in its own beautiful flavor, different psychotherapies. When they, for example, in case of cognitive behavior therapy, you will, after understanding the diagnostic label for the client, you will come up with your own case formulation, which is very grounded in the theory of mind according to cognitive therapy. Similarly, it goes for acceptance and commitment and or the other therapies as well. So for a clinical psychologist who is trained in that particular psychotherapy school, will really try and understand that particular diagnosis from the lenses of psychotherapy. And that, then our understanding of why this particular condition has emerged, what will be the thought, behavioral, and also emotional challenges. So having a diagnostic criteria in a way that way it really helps us to understand at least some way through which client is experiencing the world. Obviously, when we really meet the client and we start our work, the horizon starts expanding. And this is where I think the client's presence come into the picture, that if we are able to have that informed awareness. So we are not only sticking to the diagnosis, but at the same time being flexible enough to meet the client's moment-to-moment experience. So yeah, I think this is where the clinical psychology is coming into the picture.
Yeah, so I think, Rucha, you're really talking about also this, because of your background in clinical psychology and in presence-oriented work, the blending of the two. I remember even as studying clinical psychology, the rigor of understanding the diagnosis and that the emphasis was on getting the diagnosis right, so that you can help the person and also look at symptom reduction. So I think the whole framing of the work is also in terms of how can the symptoms be reduced, so the quality of life and the quality of interaction for the client is better. Now, you spoke about something really interesting, is that the ground in which we stand, which is what's the approach that we are using. That's really informing also what's the diagnosis, like how are we looking at the diagnosis, how are we looking at the symptoms. So maybe in this, in this conversation today, maybe we'll kind of keep the focus maybe just on that in terms of from a presence-oriented perspective, how are we looking at the diagnosis, and then maybe we can look at very specific conditions. So the view that we take in a mindfulness orientation, in a presence orientation, the view of the person is that that there is a sense of wholeness. So the diagnosis is merely looked at as it's a condition that the person is carrying, is suffering from, just like you would have any other condition, like a physical condition that you are carrying. There is something about mental health where we kind of, take the diagnosis and make it the whole person, right? And then we start viewing the person from that diagnostic lens. Whereas when we shift the perspective that like you said, that we are looking at the person, yeah, as a whole, and the diagnosis that the person is carrying is just one part of it, is just one manifestation of a certain type of conditioning, the certain experiences that the person has carried, and how that is manifesting behaviorally, emotionally, and at a belief level, at a cognitive level. So, so in a presence orientation, because we are looking at the person as whole, okay, which is different from looking at the person as whole. Okay, so so the belief is that there is an inherent sense of wholeness that nothing can touch. There is an inherent sense of okayness that we all carry that none of our conditioning can really touch, right? And that place is intact. No matter what our experiences, no matter what we are faced with, no matter how we are in the world right now, but there is an inherent beingness, this inherent presence of the person that is the unconditioned state of being, and that sense of wholeness is always present, no matter what we are faced with. So we can always touch into it, irrespective. So we don't have to fix something before we experience ourselves as whole, because that sense of wholeness, that sense of okayness is already present. So then it changes the approach, it changes the way we are looking at the person, the way we are interacting with what they are coming up with, right? What they are telling us. Because everything that they are carrying, whatever experiences that they are carrying, also has the seed of wholeness, has the seed of presence. So whether it is this deep condition of sadness, like in depression, or this sense of unworthiness, like a part within them that feels unworthy or that feels anxious, all of these places, when we meet it tenderly, when we are able to listen to it, then we can uncover that sense of presence or that inherent quality that is there in the person. So it doesn't matter then what is the diagnosis that you're coming with, right? The diagnosis helps to let us know that maybe something might be needed at a behavioral level first before we step into it. Something might be needed at a cognitive level, something that might be needed maybe with working with the body. And so we meet the person just as they are with whatever they are presenting. So from a presence orientation, the diagnosis is not so important, and therefore I said it's more of a trans-diagnostic approach, because irrespective of whatever is the diagnosis, we are meeting that experience as the person is kind of relating to it or narrating it. And in that meeting, something that is held around it, something about that is kind of opening, loosening, getting more space. There is another aspect that, from the lens of wholeness, from the lens of presence, that we are not looking at fixing, right? So a lot of the times and a lot of the work, the practitioner has to work with this urge to fix, this urge to rescue, this urge to make it better. And instead, the orientation is, can we just meet this and allow this and acknowledge just the way it is for the person? And um, so like so that sense, and I guess that is what is meant by acceptance, right? Like, you don't practice acceptance, it's just this kind of acknowledgement and allowing, and the acceptance naturally follows. So we are not fighting what the person is coming in with. And a lot of the work is also working with the client in terms of helping them to relate differently to their experience. And this whole notion of that we need to kind of fix this. I need to fix this in order to feel better, in order to live the life I want to live. So that shift is also something that we are working with from a presence orientation, that just as you are is okay.
Right.
Yeah.
Beautiful, Sandy. And I think it also reminds me the discussion like in one of the classes where we talked about how it's more about really changing our relationship with our own experience. So again, if is the relationship not coming from the fixing perspective, but really opening up and holding that space so that whatever needs to emerge, also believing that process, it will emerge. And I think this, when we have that whole sense of wholeness for ourselves as a therapist and also as a client, I think that really allows one to believe and also stay
Yeah.
there, especially when client is going through something that is very difficult. Uh, as you were mentioning, that sense of or urgency to fix something, it is also quite present. I can also sense that in my own practice when you see client is really struggling and they are really waiting for you to do something so that they can feel better.
Yeah.
So I was also wondering if you would like to talk a bit more about how, as a therapist, also we can really hold that space, which is, or maybe have that balance where we acknowledge the need to fix, and at the same time we are relaxed around it, and
Yeah.
allowing it to open, validate, and unfolding of the process happens.
Yeah. I think the first starting place, like you also shared, is that the starting place is in the therapist's self, right? So to really work with that urge that comes up, and that urge is also coming from a sense of maybe compassion, or it may be coming from a sense of, how do I look in front of the client? What will the client think of me? So we meet our own self-critical thoughts, we meet our own parts within us that kind of come in the way of really letting the client feel heard and listened to, and where their experience is allowed, right? And even what is and even this part within them that wants things to get better, of really meeting that part, right? Of really understanding its intention, right? Of that it wants to get better, it wants things to get better, and it's often like the belief is that once I fix this, then I can lead the life I want to lead.
Yeah.
And therein lies the kind of the shift for the client, that maybe I don't need to get better to lead the life that I want to live. I may need to take care of some things to meet it, but I can at the same time move towards the life that I want. I mean, this is like really coming from also ACT processes. ACT is also very similar because it is a mindfulness based approach, where the balance, like you said, the balance of holding that, yes, there is one part of me that wants to get better, right? But if I spend all of the energy in terms of just trying to get better, uh, then uh, my mind is completely focused on just that, and I lose out on everything else that is happening around me and for me. So it's like while we are waiting, what do we do? Right? And while we are engaged in the process of healing, what do we do? So it's not about waiting for something to happen and waiting to be healed, right? But I can start to kind of take the direction in towards what the life that I want, enjoy or take in the good, the glimmers that we call. And mindfulness can really help us to do that, to stop, to pause, to take in also the good. Because sometimes when we are in deep pain and suffering, our mind gets very, very constricted around the suffering. Like the whole attention is going there because obviously it is quite, intense. And therefore, the pain of it is drawing our attention to that, right? But if we acknowledge, yes, there is the pain of that, and I am having a way of meeting that. But in the meantime, as I meet with that, can I also take in what else is going on for me? So, like one of the things that we often start out with in a presence orientation is to also become very present in the body, right? And to sense this sense of okayness in the body,
Yeah.
right? So what feels okay? Because that sense of okayness is a little akin to the presence that we are talking about, just a sense of okayness. And it's not an either or. It's not either I feel okay or I am, feeling really bad about my experiences or I'm suffering. The sense of okayness can be there even when we are encountering our deep pain and suffering. And that's what we are bringing together. That's what the presence orientation is. That to bring that sense of presence or that sense of okayness along with what does not feel okay. So I can be with not feeling okay, and that feels okay. Right? I can allow that. And that's the first step of moving towards the sense of acknowledgement and acceptance. And like you said, this inner relating that can start to happen. And as I'm moving towards the inner relating, uh, and something within me is getting met, that starts to open up. And that's the healing process that happens in our presence orientation, right? That's a movement that we wish to kind of like see for the client. But it's really a movement that's happening from a space of non doing.
Yes.
Uh,
Yeah.
and if you try to do it, then we are getting stuck again in that fixing mode. right? So we, like you said, we really need to then relax in ourselves and just allow things, and then things can open up and move as they might.
Right, right. Yeah. And I think again, this is where the therapist's presence, I think, can really, is that condition actually, because it creates that conducive environment for this process of the client also to come in the picture, because client, as we already discussed, especially when they are suffering from a particular maybe clinical condition, let's call it a clinical condition, maybe anxiety, and if actually there is sense of maybe heart rate is increased a lot and I'm not liking it, it's so
Mm.
comfortable to sit with that aspect, or I'm getting the jittery feeling constantly and I just want it to vanish altogether.
Yeah,
And then when and it's very difficult for the client to really access that sense of okayness within that moment.
yeah.
So I many times believe actually it's like it's multiple times it goes from internal to external, but in this process when we are working as a therapist, who is grounded with that sense of relax and okayness, who is okay with client feeling that distress, also then our relaxation can really help a client really sit with it,
Mm.
so that way it becomes relational also,
Yeah,
right?
yeah,
So this
yeah.
is how the relationship then itself becomes that healing agency, I would say.
Yes, yes. So
Mm,
you're also bringing in that sense, the principles of attunement and resonance, right? So, what creates the okayness for the client? And maybe we can take it specifically, like you're saying, like let's take anxiety, for example, and where this this sense of, like you're saying, this racing heart, this feeling, this contraction, that's not pleasant, right? That's not easy to sit with,
mm,
and that does not feel okay. So no wonder something in us wants to move away from it, doesn't want to sit with it. But yet, it's only in the encountering of it
mm,
that that something is able to shift and move,
right.
right? So, how can this capacity for the client be built step by step?
Mm,
Very little at a time. So it's not like the approach is not like any approach, is not this magic wand that everything will be okay. But we are holding the view. And what you brought in is that in the relational space, what is really supporting, what's really the container is the therapist's grounded, embodied presence. And in the resonance, like we can be affected by, someone's anxiety and we feel the anxiety ourselves,
mm,
right? But it can also work the other way around. The more grounded and present I am and in presence, the client, the client's physiology is also responding to that in the relational field. So, therefore, the client's physiology is also able to regulate with that sense of, this racing heart or this kind of breathlessness or these racing thoughts that are happening. And there is a settling that is happening. So that would really be, like you rightly said, the container, the relational space, and that holding that is kind of provided. I think it also brings in the sense of safety for the client, that it feels safe to encounter what I'm feeling. Because maybe what keeps symptoms in place is that we don't encounter our feelings. We don't encounter the feeling sensation in the body, right? Uh, and uh, and we don't encounter it because at some point of time it was really hard to stay with it, or we didn't have the resources to stay with it. We didn't have significant people in our lives to really allow our physiology to access things. And so, really coming in then with this sense of where the therapist presence and this attuned presence to the client, where there is an inner sense of safety that the client experiences for encountering what feels unpleasant. And this is really done in a very titrated way. Like I said, it has a very a presence-oriented therapy has a very, very somatic aspect to it. So it's really done in this very titrated way where it doesn't feel too much to encounter. It just feels safe enough, right? And we are also holding the sense of okayness in the body and really moving from the sense of okayness to this intensity of feeling, right? So it really becomes okay, and I feel the client feels grounded in themselves and present to even that unpleasant feeling. And that's really the first step in terms of just simply encountering what I'm experiencing more directly.
Right, right. And I think again, just to draw a similar kind of connection from a clinical perspective, the one aspect most of the psychotherapies take is also maybe psychoeducation.
Mm.
One of the intention of psychoeducation to actually help client become familiar with the feelings, but I think what really happens at that level, at the level of cognition, maybe you still understand the symptoms and you understand how the diagnosis or the whole experience is going to follow in the predictable ways, because that's what diagnosis will do. But I think when we do it from the presence perspective and we really allow client to encounter it, I think they technically they get psychoeducated, which is more, but in the embodied way that okay, I sat with that sensation, I felt there was a sense of safety, which was first coming from the relational space. Then I was also able to notice it, and I could actually see how that sensation of maybe racing heart really, actually got very intense. And then by just being there, it settled down. Sometimes it may not immediately, but that's not the whole intention. Intention is to really allow client to experience that process. And I
Yeah.
think that becomes then informed way for them, really meeting that anxiety as it is.
Yeah.
Yeah, and another thing that also I think very beautifully comes up here is the sense of curiosity and openness that we have, where we are inquiring into, okay, what is it really saying to me? So it doesn't only become something to get rid of, in fact, something to really, again, get more information, get really meaning out of it. So I
Yeah.
think that sense of familiarity also then kind of lessens the fear of fear.
Yeah. Yeah, and that's especially so true in anxiety,
Yeah.
the fear of the fear, the fear of the anxiety, and like moving away from it. So really being able to encounter it.
Mm.
Since this is really coming also from the Buddhist perspective, it's like I remember, Pema Chodron talking about this, like it's like you are chased by the tiger, and obviously your first instinct is to run, right? But what if you turn around and face it, and that can bring in tremendous fear, but you're also then encountering the fear and you're befriending it.
Yes.
So, this befriending part is also very important, that we are coming, like you said, into another relationship with what we are experiencing, right? Um, yeah. Um, so, it's really that shifting of that inner relating. I think you were saying something about from a clinical point of view, the psychoeducation part of it, right? And you were making this kind of link where how does the psychoeducation happen from a presence-oriented approach of where the person experiences that shift. So it is a very direct, lived experience and a knowing of how to meet something, right? It's not just cognitive. Uh, but at the same time, even in because the presence oriented approach, it's a very open. It's quite huge. It can accommodate everything. It accommodates all of our experiences, which is including our cognitive meaning making part, right? But what we do here is rather than the psychoeducation coming in first, right? And then I'm looking out for that experience and putting it in some framework. I am encountering what I'm encountering, right? Like you said, with that sense of curiosity and openness. And then together with the therapist, we are looking at, okay, now, what is this kind of like telling us? How are we placing it? What's uh, and this is also coming from the client. So it's not like the therapist taking the stance of, okay, now I'll tell you, kind of what happened, but really finding out for the client what is the meaning that they are making out of it, and how is it relating to their to what they are coming, what they have originally come for, you know. So how is it relating to that? What is the sense and meaning making that they are making? So the insight from their direct experience comes from them, and we are simply facilitating that insight and meaning, and sometimes there is the joining of dots that the therapist also does.
Yeah,
Right?
yeah, yeah. And I think even having that mm, approach of that client knows it already.
Mm.
All we are doing is just facilitating. I think that also takes away some kind of burden from therapist as well. I think we really meet the client as at the very basic level of human being, having lots of regard. I think that's the again maybe one of the parameters that we have as a therapist, that really not looking at another person even as a client, but somebody who is there ready to just be there with you with all your vulnerabilities, and you're also being there with your vulnerabilities, including that part of you which wants to heal or fix or something that comes in. So I think the more allowing we become of those our own of parts which are coming in between, and really acknowledging them, really requesting them to take a step back and meeting the client as it is showing up, I think that really facilitates the process.
Yes, yes, it does.
Mhm.
Yeah, yeah.
Right, right. And maybe another thing that was also present for me, because we talked about anxiety, and usually anxiety has this a particular sense, like subjectively, it is quite, people have experienced it quite often in the different degrees. And when it comes to clinical, then obviously things become difficult for them. But in the similar case, in case of depression, depression may come up with very mixed kind of emotions as well. There is a sense of sadness at the but if you really look carefully at it, sense of vulnerability, hopelessness, helplessness, really not even having interest to move or engage into day-to-day activities, loss of interest can be very debilitating. And at the same time, along with that sense of sadness, it also comes up with another emotions, maybe hurt, anger, some kind of fear. It may have that long history as well.
Mm.
So also wondering, if we can look at depression, because it also has so much of other emotions coming in.
Yeah,
Clinically, we usually focus a lot on the sense of sadness, but I
yeah.
think presence work really can tap into those other
Yes,
emotions.
yeah. Also shame, no?
Shame, yeah,
Yes,
yeah,
so
definitely.
shame is a big one that we encounter.
Yeah.
Yes, there's very much in a presence orientation and a mindfulness approach, also being with the feeling sensation in the body.
Mm.
That's really very, very important that to tap into that feeling and to allow for the feeling, the feeling sensation in the body. So it's
Yeah.
not just the cathartic kind of feel my feeling, but really to be very present to that. To that feeling sensation in the body and allow it to move through the body. And that creates an opening and a space. Since you were talking about also like depression, we also spoke a little about anxiety. Now, both if they're both under the mood disorders, right? And the one of the hallmarks maybe of that is also the thoughts, right?
Yeah. Yeah.
So they're marked with this kind of recurrent kind of like thoughts, always being with the thoughts. Either they are this thoughts about being anxious about what's going to happen, or this ruminating thoughts in depression, right? So and it might be interesting to look at from a presence oriented point of view. How do we look at thoughts?
Yeah.
Because that's really at the core. There are thoughts, but there's also an underlying beliefs that are drawing, that are engaging in that, and there is the whole experience of the feeling sensation in the body. So, so the reference that we are making here in this approach is that we are acknowledging the thought.
Yeah.
But the one way to be with the thought is to be with the concomitant feeling sensation that accompanies the thought.
Right.
Because that's in that way, we are coming very directly in touch with experience. And thoughts are a little removed from my direct experience of things.
Yeah.
Right? So there is this movement that we make, that of acknowledging the thoughts, and as you're having that thought, what are you feeling and sensing in the body, right? And then that becoming the entry point, one of the entry points in terms of being with that feeling sensation in the body. Uh, but as we advance in the presence oriented work, then we can also allow for just that thought or just that belief to just arise and not do anything with it. And I think that's really the difference between, traditional cognitive therapy and any of the mindfulness approaches, including presence, is that we are not doing anything with the thought. So we are neither pushing it away, nor are we changing it, nor are we reframing. We are just letting the thought just be, right? And the belief just be. And and but for that, both the therapist and the client really need to be in a state of presence.
Yes.
Right? Because that can't really happen, because we know that if we just kind of like just say, oh, that's a thought, let it be, and we know how much our mind will keep kind of like searching for that. But when we are in a state of presence and there is that groundedness, we can just allow that thought to just arise and let it go as it might, right? So the holding that is happening actually is not really coming from just the therapist or just the client. There's a larger field of holding that we kind of really rest in. And the real work of presence is really from, not real work, but the deeper work of presence is really from that space of really, really not doing, But along the way, we may need to kind of support the client in various ways, also support ourselves in various ways. And so we have many tools that we can use along the way to help us to navigate what we encounter so that we can be present to it
Yeah.
and just allow.
Mhm. Right. And I think then again, this is where the therapy presence approach, actually, I think, rather than calling it just another system, it's an approach to really be I would say, be in that therapeutic space that
Yeah.
comes in. And then again, I think what really happens is, if you're really present in that resonance, I think when you notice something is there, maybe trying to really come up, you are ready to wait for that
Mm.
information to also arise. I'm using information more in the space of clinical aspect, but yeah, some emotion is getting arisen here at the for the client, and at the same time, if you're really present, I think the tool, so-called tool, if
Yeah.
it needs to come, that comes.
Yes. Yes.
Right.
Exactly.
Yeah,
Yeah.
and I think this is where I remember you sharing that quote very often in the presence work. Like, you learn all the therapies, learn all the techniques, but when you're in the therapy, meet as if you're meeting one human being is meeting another human being. And
Yeah.
just because whatever necessary needs to come, it will come.
Yes.
So I
Yes.
really
Yeah.
remember that part when you shared.
Yeah. Yeah. And trusting that process,
Yes.
right? And this is not to kind of also diminish,
Yes.
the value of all the different ways and tools and techniques. And really, from a presence orientation, you can really borrow from all the other, approaches as well and keep it at the back,
Yes.
for because something may feel appropriate at that point of time. But it's not you as the therapist kind of deciding, oh, this person has this, so let's do this, 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 and now we will move from here to here to here, And so sometimes it doesn't follow this kind of linear pathway because, like you're saying, you're really listening and attuning to the client and to the client's process. And that is informing the treatment plan.
Yes.
Yeah. So the treatment plan is really coming from the client's process. So it's after many sessions, maybe with the client, that you really come to, oh, this is something that is getting encountered,
Yeah.
and maybe this needs to be looked at first, and then that will open up. But this, what comes first, what comes second, should we go here, should we go there, is really coming from the process of the client
Right.
and from the listening that the therapist is doing to that process.
Yeah.
So you're really listening and responding to what the body mind of the client might need in that moment. And that is the emergent treatment plan.
Yeah.
Yeah. In the order that is decided by something like mm, like a larger life
Mm.
affirming kind of movement that's happening for the client, and that's determining, or uh, is is what emerges first is, you know uh, the memory when I was 5 or the memory when I was 18, and whatever feels safe within the client,
Mm.
and that will emerge first. And slowly there is the organic building of safety and the uncovering of the underlying psychodynamic uh, you know elements
Mm.
that the person is with, that is under those symptoms and under those conditions.
Right. Right. So I think it just again talks. I'm trying to understand also more from the perspective, how are we looking at the person, but at the same time, when we are saying that it's we've operated or look at it as a whole, not as a whole, but whole. And at the same time, we are also looking at the various psychological physiological processes that also go along with it.
Yes.
That's, I think, very, very important to, become aware of those processes. And although we get some understanding through our own trainings in different perspectives, most important training really comes is in that therapy session with
Mm.
the client, when the client is really, so depression, maybe client is experiencing some depressive symptoms, but experience of that depression is very unique for that particular session.
Yeah. Yeah.
And then what kind of psychological processes are really, beautifully coming up sometimes. They really show up. So I think really being open to that and honoring that
Yeah.
is one thing that is very helpful while working.
Yeah.
Right?
So I think coming back to the clinical side of it is that there is a diagnosis and we know about the diagnosis and we keep that in the background.
Yeah.
Like that's informing what may be important, but that is not determining, like I said, the treatment plan. The treatment plan is coming from the client's process.
Right.
Yeah. Um, we may know some things, like for example, in clinical depression,
Hmm.
we know that the behavioral component is important, right? So along with this inner kind of like work, we can also bring in the behavioral components. So the presence orientation is not averse to any element that needs to be brought in for the benefit of the client, right? And so all of these go together: the cognitive, the emotional, the somatic, the energetic, the behavioral, they all kind of like go together. And what is that? Uh, what's the first thing that needs to be kind of like encountered? That will also come from listening to the client.
Yes.
Yeah.
Yeah. And here, I think, like meeting the client wherever the client is, I think that particular aspect really is something that needs to be highlighted here, like as you mentioned. And so that's why not having, so it's like a very open
Yeah.
kind of a thing. It's like everything really can come, and then with the help of client's presence and your own presence, it will take its shape, whatever it needs to take, I guess.
Yeah.
As you notice, like sometimes if there is this sense of client really need to move, and then maybe bringing in the behavioral, and sometimes it comes so spontaneously for the client as well, that when they're really sensing into the body, and if there's a curiosity, what is it really saying, and when they say, okay, I think there's this just need to move something in between, and then maybe they just shift, or maybe they take a walk, and I think that's very again a beautiful way to know your inner structure and what is it really. So really being guided by that, your own inner experience, rather than just what is expected to be done.
Yeah.
This is where I think this is where my understanding.
Yeah, I think you're right. I think you're kind of like really uh, bringing that point home of, yeah, and maybe that's the difference in terms of in traditional ways, that it's not uh, going with what we think
Mhm.
is is right for the client and deciding that, but the shift to really listening and letting it be really driven by the process of the client.
Yeah.
Yeah.
Right. Hmm. Yeah.
Yeah. I'm aware of our time and that we were also to discuss, other clinical conditions, but I'm just wondering whether there are whether we should just open it up right now to maybe questions, and then maybe talk about some more clinical conditions if there's time.
Sure, sure. Sounds perfect. I think
Yeah.
it's 6:30. Didn't realize.
Mm.
Yeah. So maybe we can open it up and then.
Yes. Yeah. Yeah, Vivek. Yeah.
Hi, Rucha and Sandy. Thanks so much. It's been a wonderful revision for me and a reaffirmation of some of the principles. So I had two questions, and maybe when you are looking at other conditions, it might come up anyway. The first is in terms of ADD or ADHD, where there is, a sense of overwhelm often or an inability to focus and constant distraction. Is there a specific way in which we can work with the client and use that our presence to allow that sense of being okay even with that sense of that overwhelm which comes up? That is the first. And the second part is in depression, sometimes of the various conditions you mentioned, there's also a sense of lethargy and I just don't want to do anything, and there's great heaviness. And from a classical Buddhist perspective, at least, this concept of the thinna nidda or the sloth and torpor, and I'm not talking about mindfulness here, but more the classical Buddhist practice. They say that that is one sense category which is you do not engage with because it will sort of suck the awareness into that heaviness as well. And so they recommend that that is one sense category where you have to counteract it, right? But I just would be curious to see if, in your experience, even with lethargy, heaviness, sloth, we can work with awareness and presence.
Yeah. So, Rucha, you want to take
Yeah,
some
so
of that?
maybe, thank you for that question. I also started, the part of me was really trying to get into that aspect of ADHDs primarily. I think that's the first question which you mentioned. And I think for, again, having that informed awareness with the condition per se, being the neurodivergent, let's call it in that form. With ADHD, what according to me can be really again helpful. One aspect is again our own therapist calmness, but at the same time I feel especially in that case when a client senses the need of some sense of structure because everything gets so difficult, I feel bringing in the mindfulness here and actually in some cases really in the session working with clients to really help them get in touch with that restlessness, and at the same time being okay with that restlessness can be of great help. And also bringing in some structure in that case to the session also helps clients. So I remember working with young adult because I also work in the university, so who was also really struggling with that sense. But more first aspect that really started was with then working with those small chunks of the time with the client, because that was really necessary thing for the client, that I find it very difficult to sit, but then really getting in touch with that sense of impulse of getting up, and can we really allow that as well, rather than putting it as a just my ADHD thing, which was really coming up for the client. So the more we started doing that, I think there was some sense of relaxation with the sense of restlessness, impulsivity that was coming in. And I also felt that when you bring in mindfulness to that, at least client is able to see that impulse emerging and then being really able to decide whether she wants to respond to it behaviorally or she wants to do something else. So I think that is one very beautiful way through which mindfulness can really come in the picture, and
Yeah.
our own acceptance towards it.
Yeah, yeah. Just to add to that, I think you're also bringing in what you're talking about, which is also the choice point that emerges, right? Otherwise, it's like we are just moving with the habitual pattern and then really being in touch with that impulse as it arises, right? Being able to catch it and then seeing, okay, what's the best way to respond to this?
Yes.
Vivek, your other question about sloth, heaviness, whether those states we can just allow So, we were just having our supervision just some time back, and one of the students in the course kind of brought in this client, session where something was the state was just allowed, and I said that when there is very deep, like presence has many layers. We're not talking about just being present or just mindfulness. Mindfulness is really the pathway to this deep sense of presence, which is our unconditioned state of being. And when there is that field of presence, both by the therapist and the client, we can allow for these states to be there just as is. Most often, and this is a growing capacity both for therapist and client. So sometimes, even from a physiological perspective, when there is a lot of heaviness or this kind of slot, not really like in depression, not being able to do anything, and then it is wiser to kind of get into a shift of at a behavioral level. Like, even if I don't want to do something, can I anyway move? And that would need for the person um, to understand, okay, why would that be important for me? So getting an understanding of that, this is because this is a movement towards the life that I want to live. Yeah, which is what I was talking about earlier. And so the behavioral aspects really come from that place, which is also a very act perspective, right? And also, it doesn't make sense to kind of just be with the heaviness if we cannot really be absolutely present to it. So none of these emotions or whatever, we do not advocate in a presence orientation or in any of the mindfulness approaches, that you just be with emotions if you're not present to it, if you're not able to be present to it and do not have the capacity as yet to be present to it. Because then we can get, and our system, our physiology can get very overwhelmed. And the slow state that you're talking about, that's more of a dorsal state. And the dorsal state does need some kind of intervention. So it does make sense to, instead of that, just acknowledging it and then choosing to do something resourceful at that point of time. Till one is able to really be present and work with it directly. Yeah.
Thank you, Rucha. Thank you, Sandy. It was very insightful.
And Sandy, I think maybe I just wanted something reminded me of that this aspect of really touching and moving away sometimes also, that we engage a lot, and that again gets informed by clients' experience and our own resonance as well. Sometimes maybe as a therapist, we also notice that it's a huge thing, and maybe just getting immersed into that can overwhelm the system. But at the same time, really going, touching there,
Yes.
and then just coming back
Yes.
to the safety. That I think, especially in case experiences like this, can be very beautifully held. You don't have to be afraid of that or get overwhelmed, but at the same time, you're not moving away from it.
Yeah.
You are just being mindful of its enormity that's present at the moment.
Yeah.
Right. Mm-hmm.
Yeah. So I'm wondering if there are other questions or explorations that anyone would like to kind of engage in.
Yes. Just it was good revision attending your session. My supervisor mentioned that there is a parallel process happening in me, and how can this mindfulness uh, practice can help me with parallel process? Thank you.
Can you say something more about this parallel process?
So this agency is working in Australia. Where we were helping homeless people. So we were delivering food packets, and I was returning to Australia after a long break. So my supervisor said, maybe I'm identifying with them while I'm working with them. So how do I? So this is not just happening in that one occasion. Maybe this is happening in other areas of my life as well. Parallel process.
Yeah. So the sense of identification with the people you are helping.
Yes, correct. So not yes, working with. Uh, yeah, in helping profession. Yes, helping. Correct.
Yes. Yeah. Yeah. Uh, yeah, I think we do encounter that in especially the mental health field, or when we are really supporting others. And it's our own deep sense of compassion also that gets us there. And then we feel kind of drawn into the other person's experience. And part of the work and the training is also in terms of how do you come back to your own sense of ground and feel grounded. So I think in the presence orientation, I think that's really very helpful to be grounded in ourselves as we are with the other, and also at an energetic level of really seeing this um, you know, being able to separate, okay, this is what's happening for me as I'm encountering this, and this is what's coming up for me, and this is something that may need attending to within myself, rather than extending at that time to the other. Yeah. So it's working with these processes you know, um, of our attachment patterns that can come up, or feeling very immersed in the other, but that in which we lose our ground. And so then we just learn to come back to our own sense of ground.
Mm. Mm. Uh, what's really present for me also, Sandy, this shift that I'm noticing even in the training of psychotherapists in different schools, where this aspect of taking care of your own self, or really becoming aware of your own patterns as a therapist, and bringing in compassion towards your own self, and that loving kindness aspect. I think that can really also, that sets that ground, especially when you're really holding that space for someone else who is also going through a difficult time, right?
Yeah.
Yeah. And in presence work, there is tremendous kind of, emphasis given on your own work that you do, your inner work. So it's
Yeah.
something that you just get trained into and then start implementing.
Yeah.
You know?
And also this, what you're bringing in, Rucha, is that it's not just about seeing from this distance and just knowing one's patterns, but this sense of also compassion and the sense of self-compassion, like really coming in from that sense of attention and care even towards oneself and what one encounters in oneself, even as a therapist.
Yeah.
So if there aren't any other questions, I'm wondering, Rucha, is there something more that we wish to share, or we can also bring it to a close?
Nothing is really present for me. This feels quite complete at the moment.
Yeah.
Yeah.
Yeah. And maybe we can just take a moment with that in terms of just seeing if there's anything more around this that we wish to explore, just as a group. Yeah, Harpreet.
Yeah, hi Sandy. Hi Rucha. We have Sandy discussed this in the past briefly, but this keeps coming up to me of how the presence approach can be practiced with adolescents and children. And there I do notice the talk approach sometimes doesn't support as much, as well as the additional factor of parents coming in, where there's a holding that is needed for them too. And how does that uh, bring in, and how can we work with that? If you can share something about it.
Yeah, Rucha, since you're surrounded by young adults right now.
Right. I completely resonate with that aspect when really talking and also settling the kind of, one of the prerequisites which we may expect in the presence work while working with adults can be difficult. I'm working with adolescents, primarily young children. I'm a bit unsure of how it will unfold, but with young adults and adolescents, as I was mentioning, really being aware and attuned to what is it that they sense that is really needed for them. I think really meeting them at that level is very important here. And most of the times I have seen, although my setup is actually we sit in the cabin, we don't have lots of opportunity to move. But in the session, if the client is actually willing to, I have noticed getting into some kind of movement in that small cabin setup as well. Uh, Helping client, I think, becoming mindfulness skills in that way. Sometimes also, I have to work as a facilitator sometimes. It is very difficult to just listen, at least in the initial process, as we are building some resources where they're also able to, maybe identify their own thoughts, sometimes really sitting with it. So I notice sometimes I have to engage bit more actively. Doing a phase that definitely comes in. It's difficult to just be there and wait. But I have also noticed as they start noticing something is getting shifted here, it's like starting from that activity actually to really getting more in touch with their own selves. I think this is how the transition, at least I have seen in last 2 years primarily. I have to definitely bring in some kind of maybe it's just by starting with the grounding, where I have to actually instruct that, okay, let's begin with the grounding. How does that feel? And then we notice that it becomes a norm then slowly. But then you really start with that, and then again, otherwise the process really follows. But in the initial, there has to be some hand holding that is required.
Yeah. And also, like you said, doing it in small bits, like not so maybe also including other ways in which this teen will kind of engage and relate and what feels comfortable. And again, it's about the relational safety, right? And regarding involving parents and all, I think, yes, for young people, working with the environmental factors, like if that is workable, right? And if there is the consent of the person as well, which can be helpful. And very often, I think also from a presence point of view is that you don't hold like, oh, the parents are at fault, because parents have their own history, their own experiences. And just like internally we hold that, for this client who is encountering whatever they are encountering, that there is the seed of presence, there is the positive intention. Just like that, when we are listening to the parents, to really understand and listen to their positive intent, however that is coming, it may not be coming in the right ways that are helpful and useful, but there is underlying that some kind of uh, something inherently good, and that goodness needs to be uncovered. And when it's uncovered, then it can be seen, oh, how else can this be kind of, how else can we come from this place? Yeah. So, I think it forces us, this, any kind of practice, and this kind of orientation forces us to again and again, coming back to what we began with, again and again, coming back to seeing from this place of wholeness.
Yeah.
Yeah.
And I'm noticing that I'm working from an assumption that adolescents would need more hand holding and directiveness. And I'm wondering if this is kind of a assumption that is a thing I have to work with, or is this something which is perhaps true? And that is something we can then, where we can bring in more directiveness while working with children and adolescents, or is it something that what I've gathered, or something I have to like work through?
Yeah. Harpreet, from a presence orientation, it is all about listening.
Yeah.
This really deep, interested listening with curiosity, being really seeing it from that perspective of what the world and what the experience looks like. And that would hold true whether it is for children or adolescents or adults or anyone, because underlying that is the assumption that we are holding, that that there is deep wisdom that is held, and in the way we are with the other, from our own presence, from our listening, that deep wisdom can come forth and guide the way.
Thank you.
So, yeah.
Anuja, I think.
Yeah.
Yes, good evening. Thank you for a wonderful, insightful session. I had a question about taking forward the consideration that the management or the treatment plan is usually client specific than the diagnostic label. Have you come across any such clients wherein this approach couldn't bring that kind of healing process or that safety, taking into consideration the intensity or the detailed history of that particular client? Any such cases where the contraindications
Yes,
could-
yes.
could have manifested.
So where reality testing is not really there, we cannot use this approach, right? In the sense of contraindications would also be if the person is not able to be present to their experience. Then you can't use this, but as the therapist, you can be very present and grounded in yourself, right? But you won't bring the client's attention in the body. You won't do all of that because that's a very slow capacity building that needs to happen. And so you would not use it if a person is not able to be present to themselves, because the whole approach is also like, I think Eugene Gendlin, who's the developer of focusing, he says, you can't smell the soup if your head is in it, So in some way, can we move out and so that we can see our experience more clearly. We can be with our experience, and allow it. And in order to do that, there may be several steps that might be needed before that happens. And that is true for some clinical conditions, right? So, while we were talking about depression, where it is moderate, mild depression, yes, we can use this. But when it is major depression, you would need other things, like you would need the behavioral aspects to come in first, and maybe working with that for a long time just to get a sense of, a feeling of agency, being able to come into even a sense of grounding. That's so hard for, somebody with major clinical depression, like. We also, where it is schizophrenia or whatever, we are not going to use this approach at all. Then, Rucha, you have any others? But when it comes to even like, let's say, like borderline, it can be very, very useful because it's so relational. And a lot of what is experienced when there is borderline is that the relational safety is just not there. And it takes a while for that to be established. And yeah, so, but for some clinical conditions, you will need to combine it with other things as well. Including, including medication that might be needed, and where some of that can be kind of brought down, and then you can start to work with the person, which is true for any other therapeutic approach as well. So those things would hold true.
Absolutely. So I get the idea that it is most importantly the clinician's judgment where to incorporate these kind of techniques or this approach, and to really understand what kind of outcomes that particular therapeutic stance or therapeutic alliance is going to bring. So I realized the training, or that the skills that the therapist needs to inculcate to really have this approach in practice. Thank you so much, ma'am, for the answer. I got the clarity.
Yeah. Thank you, Anuja.
And I think, again, this is where the informed practice really comes into the picture, and therapist awareness, as like Anuja very rightly mentioned, that having that like clinical ability at least to understand.
Yeah,
so that you can
that is needed.
Yeah, that's needed really. Thank you.
Yeah, so we are not abandoning that, what shall I say, the clinical insight,
Yes.
right? It's just that we are not moving with, so if you have this, then we move in this way. So we are still kind of like really with where the person is and what might be needed and how best to kind of support at that point of time. We would still work with a non-fixing kind of framework, with a non-doing kind of framework, and seeing the person as whole. Okay, all right. So we kind of come to the end of our time together today. It has been wonderful, and thank you, Rucha. As always, it has been wonderful to kind of dialogue with you. And yeah.
Thank you, Sandy. It was such a delightful, refreshing kind of conversation. Thank you.
Thank you all. Bye.
All right.
Thank you, Sandy. Thank you, Rucha. Grateful for your time. Thank you.
Yeah. All right. Thank you, Gayatri.
Thank you. Bye.
Thank you so much. Bye.